card.
Good evening. I'd like to welcome everybody to the Beadle County COVID-19 Task Force Community Update on February 2nd, 2021. We're going to discuss an important topic tonight. We're going to talk about vaccinations. We have a whole group of staff from different clinics around the area that are going to discuss that. If you have questions as we're going on, I'd encourage you to email them to covid19@huronsd.com, or you can go ahead and ask those questions through the YouTube stream. Once again, that's covid19@huronsd.com, and I think we'll get started. We'll just go around the room and have everybody introduce themselves, and we'll go from there.
Thanks, Mark. So I'm Dr. Joe Carr. I'm representing the Beadle County COVID-19 Task Force. So we wanted to start this media presentation out by just giving you where we're at currently right now with what the task force is doing, and then we're going to transition into where we're at with the vaccinations. So as of yesterday, we had 0 new COVID-19 patients, and our active patients with COVID-19 was 55. That is remarkable considering where we've been over the last 10 months. We can all breathe a little sigh of relief knowing that if we can keep our numbers down like this, we can start focusing on the vaccinations, and that's why we're here to discuss how we're going to proceed with vaccinations. But to do this, we still have a lot of work ahead of us. We're currently 10th in the number per county in South Dakota, and for the longest time, we were first or second. So we should all be very proud of ourselves that we're heading in the right direction. To list a few things that we're currently still doing with the task force, we still have our testing center open 5 days a week. We continue to plan on doing that as long as we need to. However, if our numbers continue to stay low, we may transition to just 3 times a week on Monday, Wednesday, and Friday in order to conserve our resources. We still are operating our call center every day of the week, and on weekends on emergency calls, one of our call center people does have the phone. We're there for education, support, to answer any questions, help coordinate care, setting up testing, and so forth. The number is 353-6214. We also have our contact tracing team that has been set up with the assistance of the state of South Dakota. We currently are contact tracing for 6 counties. The counties are Beadle, Kingsbury, Han, Sanborn, Spink, and Gerald. We initially started out extremely busy with contact tracing, but thanks to our numbers, that has slowed down as well. The task force believes that the next 8 to 12 weeks are extremely important for multiple reasons. Just to name a few, with all the new mutated strains that are coming into the country, we have to remain diligent in order that those strains don't cause more severe spikes. We have to remain diligent with what we're doing so we can focus on getting the vaccinations out. And number 3, and not the least important, we want to keep our guard up, because if we remember a year ago, February, March, everything was shut down. Schools were shut down, activities, not just for our youth, but for everybody, was shut down. So we have a window of opportunity. If we can finish out this school year strong, let the kids participate in their state tournaments, let them participate in their spring activities, that will be a huge morale booster for the battle against this virus. So to do that, we're asking you to continue with your mitigation strategies. Wear your mask, social distance, wash your hands, and sanitize. If we continue to do that with our low numbers, things will continue to be positive in our community. With that, the task force will move over to just assisting wherever we need to as a direction from the hospital and the clinics on what they need to do to help with vaccinations. And from there, I will pass it on to the clinics and the hospital so they can discuss their vaccination strategies.
Okay. We'll start with Dawn Allen from HRMC.
Okay, hello. I'm Dawn Allen, Vice President of Patient Services at the hospital. I'm also in charge of coordinating the COVID vaccine rollout. Today, HRMC has vaccinated 1,649 frontline healthcare workers, EMS workers, public health workers, those front-facing priority 1A and 1C is determined by the Department of Health for both Beadle and Sanborn County. The distribution of the vaccine comes from comes federally down to the Department of Health, who distributes it to 4 systems within the state of South Dakota: Avera, Sanford, Monument, which is out in Rapid, and then what's called Northern Health Plains Network, which is a network of 4 hospitals in this part of South Dakota: Brookings, Watertown, Huron, and Madison. We get our allocations from the Northern Healthcare Plains Network, and the amount of doses that we get per week has varied anywhere from 100 doses a week to 500 doses a week. This is important because the vaccine is still hard to come by, in that there is only so much to go around. For an example, in the state of in our area, Beadle and Sanborn County, we have over 6,000 people that fit into priority group D, and that is our patients that are 80 and above, 65 and older, people with 2 comorbidities, our teachers, child care workers. There's over 6,000 people in that group, and we get about anywhere from 200 to 400 vaccine doses a week. So that takes a while. I think we're all trying to get vaccine in arms as much as possible. Currently, we're vaccinating patients, the clinics are vaccinating patients that are 80 and above. Occasionally, you may hear where someone has received the vaccine who is younger than 80, and that's because vaccine is precious. And our goal is to get it in as many arms as possible and not to waste a single dose. One of the things about the vaccine is that once you open a vial, you have 6 hours to deliver that medication. Otherwise, it has to be discarded. So you have to use all of the doses which are in that vial. So at the end of a clinic day, if we haven't used all 10 of our doses, we look to see who we can give that dose to, so we're not wasting any. So right now, the hospital is pretty much done with all our priority 1A and 1C, which is the healthcare workers receiving their first dose, and we are now distributing the vaccine out to the clinics who are vaccinating patients. And so I'll turn it over to one of the clinic, Leanne from the Hearing Clinic, if you'd like to.
So it is our effort to get it out to the 80 and older, and that's where we have started. This is a community effort, and I do thank the hospital for coordinating a lot of this for us. Our staff is very excited to get it out, and the people that we have offered it to and that have come in to get it, the stories are phenomenal about how excited they are. Also, as far as distribution of this, I just look forward to getting everybody in the community vaccinated. If you haven't been called, we have tried to reach out to our 80 and year older patients. Sometimes we don't have a good phone number. So please call the clinic and give us some updated information so that we can get to you, or if we leave a voicemail, please respond. So.
Cheddar Home Clinic.
Good evening, I'm Danielle Ratchin, a nurse practitioner at Cheddar Home Clinic. On behalf of everybody at the clinic, I just again am thankful to be able to be here and to be at this point. It has been a long year, but I feel like we're making good progress. We have a lot to be hopeful for. It's really no secret that we have a significant elderly population at Cheddar Home Clinic, as well as a lot of younger patients with several comorbidities as well. So how we are doing things at Cheddar Home Clinic is we do have a list of our patients that we have run off that have been seen within the last year. However, those patients that have called in and asked to be placed on the list, you're kind of highlighted on that list, and you will be the first people that we do call. So if you are wanting to be one of those individuals to be called sooner rather than later, we just ask that you call. You can just leave a message with the front office staff when you call that you would like to be on the COVID vaccine list. And as Leanne mentioned, if we could please get updated contact information. We are currently through our transplant list and our active cancer patient list. We are working on those over the age of 80. There are several folks that we have not been able to reach. So again, if you aren't sure if you're on the list, if you're not sure if we have your updated information, please let us know. Stacy Quam has been doing a wonderful job coordinating things at the clinic. So how it works is you will be getting a call as to a time and come in and get taken care of. So like I said, if you want to be there sooner rather than later, give us a call. Otherwise, we will be calling everybody as we get further down the list. So we just appreciate your patience and cooperation through all of this.
Good evening, I'm Jennifer Callahar, and I'm the director at the HMC Physicians Clinic. I have with me today Janice Christensen, who's leading our vaccine efforts at our clinic. We're also working on our list of 80-year-old and over, also the transplant list and active cancer, somebody on dialysis. We typically will do our clinic on Wednesday because that's when we have the right amount of staff, and then we can do it in a pod style, and that's kind of how we've been doing that. Janice, anything you want to add about the vaccine, how it's going?
We've had two clinic days, and the response from the patients that have come in has been remarkable. They just, as long as you call them, they will find a time to get there, and they have just been so pleased, and I've had very good response from family members and encouragement from family members that the patients do get that if it's all possible. And as Jennifer said, we did start with the 80-year-olds, and we've had many patients that are even in their 90s, and they are just so willing to come in and just help this cause and make this better. So it's been a pleasure to get to know the people and to see how responsive they've been to it. In my past in community health, I've done a lot of immunization clinics and things like that, and it's just, this is probably one of the most pleasurable jobs I've had as far as doing the clinic part of it. So I've really enjoyed getting to know them and finding out how pleased they are.
Thank you, Janice. And just like we said, I'm not a frontline worker, but being on the call and making those calls, it sure has been a hard year as far as getting through everything that we have been through, all the changes that have taken place in this last 12 months. And so being on this receiving end of giving somebody a little hope of a phone call that maybe I'll be able to hug my grandbabies this summer, it's just been really rewarding making those calls. And so we really do want to encourage everybody who wants to get a vaccine to call the clinics, get on the list. Like Dawn said, there's a limited amount, but in time, we'll get to everybody. And everybody who would want a vaccine, our hope would be that they'll be able to get one. It might take a year, but what we've been through last year, then I think we can wait and hope for our call to get that vaccine. So, thank you.
A couple things I forgot to add is right now we are administering the Moderna vaccine, and it is a 2-dose vaccine. So you'll have your initial dose in 28 days, plus or minus a couple, you'll receive a second dose. The latest literature shows you can take ibuprofen after the vaccine, but the recommendation is not prior to receiving the vaccine right now. And the side effects are pretty much as what we anticipated or expected. They range anywhere from a mild sore arm to muscle aches, joint discomfort. We've had some people with fevers and chills, that type of thing. So those are the side effects that we are seeing. We have not had any anaphylactic reactions in our area at this time.
I would just like to add one more thing from a healthcare standpoint. I've had a lot of patients call and want to talk to me about the vaccine. I do feel like it's safe. I do feel like it's something we should get. But if you have any specific questions, I'm sure all of the providers will agree that we are more than happy to talk about it. So if you don't want to come into the clinic, you can certainly call, say you would like to speak to your provider about whether or not we feel this would be good for you, and we'd be happy to answer any questions for you.
So just a reminder too about the vaccination. When you read from the CDC and you listen to what they're saying about the vaccination, it's the goal to get 70 to 85% of the population vaccinated before they talk about that herd immunity. So what is it, Dawn? We've had how many in Beadle County so far that have been vaccinated?
Well, we've done 1,650 healthcare workers,
Yeah.
and probably around another 800.
Okay.
800
so we're at
patients.
20-ish percent, 20%, so, which is awesome. But as we've all stated, it's going to take a while to get to that 70 to 85%. So just because you are vaccinated, just because you may have had COVID, we still have to keep our guard up. We don't, if the vaccination is anywhere from 95% effective to the J&J might be 85% effective. There are still a lot of variables that we have to keep that virus knocked down while we're doing the vaccination. So in the end, whether it be 6 months, a year, whatever, that it's going to be extremely effective. So just remember, keep your guard up, get that vaccination, and hopefully things will be a much brighter year for this year to come. Does anybody have anything else they've got to add, or we can turn it back to Mark here?
If anybody has questions, I encourage you to email them to covid19@huronSD.com. And I know we kind of already touched on this, but I said I didn't have any questions, but something came up. I hear this a lot. If somebody's on the fence, what recommendations or what, I know we talked about calling their provider, but what are some of the things that providers are, maybe telling patients what's going on, or
I've had a lot of patients ask me, I have rheumatoid arthritis, or I'm on medicines that are immunocompromising. Should I get the vaccine? I've actually talked to 2 rheumatologists. I've talked to an oncologist. The things that I'm hearing is that, yes, you should get the vaccine. What you need to keep in mind is we don't know how much of a response your body individually is going to mount. So maybe for you, you might not get up to that 95% effectiveness, depending on what medications and things you're on. But anything we're doing is certainly better than nothing. And with you being an increased risk, then it's definitely worthwhile. So again, I think we're all willing to have these conversations with people. If you have questions about things that you've read in the literature, just make sure that things are from a reputable source. There's a lot of things out there on the internet that simply are not true. So have these conversations with people, look to good sources, and again, call if you have any questions.
Mark, what I find an interesting thing when you said that, initially, when we first started talking the vaccination, let's say 8-9 months ago, we thought it would just be certain groups that might be, I'm not going to get vaccinated because, but it seems to be across the board and legit concerns. So one thing that we found very interesting, my brother Wayne does a lot of functional medicine, so he's with that group of providers across the board, whether they be medical doctors, chiropractors, osteopaths, nurse practitioners, PAs, whatever. And the leaders in their profession have come out and said the research they've done with this vaccination it's very impressive on the quality of it. And they were very for vaccination. So I don't think it's any one faction pushing this. I think it's healthcare and people across the board saying if we're going to get to that next level, the vaccination is a huge assistance to get us there. So, as Danielle said, the more you can research on your own from reputable sources and ask questions to people you trust, I think that's the big way to help you, whether decide whether you do it or don't do it, but do it with an educated decision.
I guess, Dawn, talking about, I don't know if you want to go into specifics, how many doses you're receiving on a regular basis, but you want to emphasize that this is for Beadle County residents and also Sanborn and how that is being rolled out.
You know, and the allocation of doses is limited, but we have seen it increase over the last few weeks. The state of South Dakota is receiving more, and it's being prioritized out to those areas based on population and where the communities are at in vaccinating their 80-plus-year-olds. But for example, last week we received 500 doses to distribute out amongst the clinics, and this coming week we will get 200 doses. And it's just because the amount that's coming into South Dakota hasn't been decreased. It's just being allocated where the gap is in vaccinating 80-plus-year-olds at the present time.
Okay, so it's possible that more doses maybe went West River where it's harder to get,
Right.
you know, there's just getting.
Yeah.
But the biggest thing that I've gathered tonight is get in contact with your primary care physician, try to get on a list and see what your options are there.
Yeah. And, you know, one thing when you mention that, what I really have seen, because I do participate in a statewide call, is that I have not seen systems want to hoard the vaccine. They really are distributing it out so we can get to the priority groups and where the biggest need is. And so everybody's kind of sharing and working together as a state.
And I just wanted to mention too, when you said call your primary care, if you don't have a primary care provider, you can call any clinic in here and they will get you on your list. We just want to make sure everybody heard that too. If I don't have a primary care, who do I call? Well, you can call your clinic of choice and get on the list at any clinic.
Which includes Sanborn County.
Okay? Yep.
Ben, questions? No? Anything else that anybody would like to touch on? Or are we good?
I think we're good.
Okay. I would like to thank everybody for tuning in. This will be rebroadcasted. The link will be shared on Facebook because I know there's basketball going on. If you do have questions, get in contact with your primary care physician, or you can also get a hold of HRMC or the physician's clinic to make sure you can get on that list if that's what's going on. So I thank you for your time. Everybody have a good night.